Welcome to the Deep Dive. Today, we're going to be taking a deep dive into something really fascinating. Imagine if you had an AI that could, actually diagnose medical problems better than most doctors.
It sounds like sci-fi. It does.
But that's exactly what we're going to be talking about today.
Yeah, and what's really amazing is we actually have a research study that analyzes how one of these AI models stacks up against, real doctors.
Yeah, this is OpenAI's O1 preview model.
Yeah.
And this isn't, just like answering some multiple choice quiz. This thing is tackling some pretty complex cases. I mean, we're talking generating diagnoses, differential diagnoses, and even suggesting treatment plans.
It's incredible.
So get ready to be surprised by just how capable this AI is.
Yeah.
And what that could mean for the future of healthcare.
Yeah, for sure.
Okay, so let's jump right in. So they started by testing this O1 preview model on some seriously tough diagnostic challenges.
Yeah.
We're talking about challenges that have been, stumping medical students and doctors, for decades.
Yeah, they use these things called clinico-pathological conferences.
CPCs.
CPCs.
Okay, yeah. Those are published in the New England Journal of Medicine, right?
Yes, exactly.
Okay, so these are famous cases.
Oh, yeah.
Yeah.
They're legendary in the medical world. They're intricate medical mysteries like you would find in a detective novel.
Okay, and so how did O1 preview do? I mean, these are meant to be really hard.
It aced them.
Really?
It correctly diagnosed the case 78.3% of the time,
Wow.
with the first diagnosis being correct in over half of the cases.
That's incredible.
It really is.
Okay, but hold on. How do we know this AI isn't just a super-powered memorization machine?
Yeah.
Maybe it's seen these cases before.
Yeah, that's a great question. And the researchers actually thought of that too.
Okay.
So they specifically chose cases that were published both before and after this model's training data cut off.
Okay.
So it couldn't have possibly seen them before. And guess what? It made no difference in its performance.
Wow. So it's not just pattern matching. It's actually showing some real understanding of medical concepts.
Absolutely.
Okay. So to really understand how impressive this is, can we dive into a specific example?
Sure. So one case that stood out to me was where O1 Preview diagnosed a patient with pulmonary Langerhans cell histiocytosis.
What?
Yeah. It's a mouthful, right? It's a
Right.
really rare and complex disorder.
Okay.
And what's remarkable is how the AI considered all these different factors, like the patient's symptoms, medical history, test results, to arrive at the diagnosis.
And these even experienced doctors would have trouble with these types of cases.
Absolutely.
This was not a simple case.
Okay, so this is pretty amazing. And just to be clear, GPT-4 that missed this one right.
Totally missed it.
Okay, so that really shows that O1 preview is a big step forward in AI.
Yeah, it really does. Okay, so we've seen that this AI can diagnose like a pro, but can it explain its thinking like a human doctor?
That's a great question because, in medicine, it's not enough to just get the answer right. You have to be able to justify your reasoning and communicate it clearly.
Right, you have to be able to teach other people.
Exactly.
Okay, so how did they test this? How did they know if it could actually explain its thinking?
So they use these things called NEJM healer cases. They're virtual patient encounters
Oh, okay.
designed to test clinical reasoning skill.
So it's like a simulation?
Exactly. Like a
Yeah. simulated
doctor-patient interaction where the AI has to gather information, ask questions, and come up with a diagnosis.
Oh, okay, that's cool. And then how did they evaluate how good its reasoning was?
So they use this validated scoring system called the RADA scale. It basically measures the quality of the reasoning.
Okay.
How accurately it identifies the problem, how well it prioritizes different diagnoses, and how clear the explanations are.
Okay, so it's like a rubric.
Yeah, exactly.
Okay, cool.
Okay.
And how did it do?
Hold on to your hat because O1 Preview got a perfect RIDA score
Great.
on 78 out of 80 cases.
Wow. That's incredible.
It is.
So how does that compare to actual human doctors?
It was significantly better than attending physicians, resident physicians, and even GPT-4.
Wow. Okay, so this AI can diagnose, it can explain its reasoning, but diagnosing is only one piece of the puzzle, right?
Right.
What about actually figuring out what to do about it? Can it create a treatment plan?
That's a great question.
Yeah.
And that's the next logical step, right? I mean, it's one thing to identify the problem, but it's another to come up with a plan to address it.
Yeah, yeah.
So the researchers wanted to see if this model could go beyond diagnosis
Okay.
and recommend management strategies.
Okay, so how did they test this?
They used two sets of case studies
Okay.
called Gray Matters and Landmark Diagnostic. And both of those are based on real-world medical scenarios.
Okay, and how did it do?
In the Gray Matters study, it did incredibly well. It
Right.
got a median score of 86% per case.
Wow. So not only is it a great diagnostician, it's also really good at, like the strategy side of things,
Exactly.
coming up with a treatment plan.
Yeah, and keep in mind, managing a patient involves a lot of complex decisions, like, what treatments to prescribe, what tests to order, what kind of follow-up is needed.
So it was able to take all of that into account.
Yeah, it was able to consider all these factors and come up with a course of action that aligned with best practices.
Wow. So is this thing ready to like take over the doctor's office?
Well, the results from the landmark diagnostic study were a little bit more nuanced.
Okay.
In that study, O1 Preview did similarly to GPT-4,
Okay.
and it was slightly better than physicians with or without GPT-4's assistance, but that difference wasn't statistically significant.
Oh, okay. So it's not a complete AI takeover just yet.
Not quite.
It sounds like there are still some areas where human doctors might have an edge.
Yeah, it seems that way. And actually, there's another area where this AI shows some limitations.
Oh, really? So even this incredibly advanced AI has some weaknesses.
Yeah, it does.
Okay, I'm intrigued. Let's dive into those limitations after we come back. All right, everyone, we'll be right back. Welcome back to the deep dive. Before the break, we were talking about O1 Preview and all the amazing things it can do. I mean, it's really pushing the boundaries of what we thought was possible with AI in medicine.
We saw how it can diagnose these really complex cases and explain its reasoning, sometimes even better than human doctors. And it's even starting to get good at figuring out how to manage patient care, like recommending treatments and stuff.
Right, but you also mentioned that even this super advanced AI has some limitations, some areas where it's not quite there yet.
Yeah, one area where AI models, even ones as sophisticated as O1 Preview, still face some challenges is in something called probabilistic reasoning.
Probabilistic reasoning. Okay, I'm not sure I'm familiar with that term. Can you break that down for me? Like, what exactly does that mean?
Sure, imagine you're a doctor, right? And you're trying to figure out what's wrong with a patient. You have some clues, like their symptoms, their medical history, maybe some test results, but you don't have the whole picture.
Okay, so there's some uncertainty involved.
Exactly. Probabilistic reasoning is all about dealing with that uncertainty. It's the ability to estimate the likelihood of different diagnoses based on the information you have. It's like weighing different pieces of evidence and trying to calculate the odds.
So instead of saying, this is definitely what's wrong, you'd say something like, based on what we know, there's a 70% chance it's this and a 30% chance it's that.
Exactly. You're thinking like a doctor now. That's probabilistic reasoning in action.
So it's a really important part of how doctors make decisions in the real world.
It's essential.
Okay, so how did O1 Preview do when they tested it on this kind of reasoning? Could it handle those probabilities effectively?
Well, to test this, the researchers gave O1 Preview a bunch of real-world cases, the kind of stuff you might see in a primary care setting, and they asked it to estimate the probability of different diagnoses, just like a human doctor would.
Okay, so it's like a head-to-head competition.
Exactly. And to make it even more interesting, they had over 550 actual medical practitioners, from residents to attending physicians to nurse practitioners, work on the same cases.
Wow. So it was a real human versus machine showdown. What happened? Did O1 Preview prove that it was a master of probabilistic reasoning too?
Well, the results were a bit more mixed this time. O1 Preview did okay, but it didn't really outperform those 550 human practitioners. Its performance was also pretty similar to GPT-4.
Huh. So it seems like probabilistic reasoning might be a bit of an Achilles heel, even for these really advanced AI models.
It seems that way. It's interesting, right? Because in other areas, O1 Preview is just blowing human performance out of the water.
Yeah, it makes you wonder why this particular type of reasoning is so tricky for AI. Any thoughts on that?
Well, one possibility is that probabilistic reasoning is just inherently more abstract than some of the other tasks that O1 Preview excels at, like diagnosis and management. Those often involve following specific steps and guidelines. You look for certain symptoms, order certain tests, and there are established protocols to follow.
It's more like following a recipe.
Exactly. But probabilistic reasoning, that's more about weighing evidence that's often incomplete or uncertain. You have to consider all the possibilities, factor in the unknowns, and make a judgment call based on a bunch of different factors.
Yeah, there's no clear-cut formula or algorithm for that.
Right. And it's possible that this type of nuanced decision making, where intuition and experience play a big role, is where human doctors still have an advantage.
So maybe it's not just about crunching numbers and applying algorithms. Maybe there's a certain art to probabilistic reasoning that AI hasn't quite mastered yet.
That's a really interesting idea. It really makes you think about the nature of human intelligence and what it means to think like a doctor. Like, what is it that we humans are doing that AI is still struggling to replicate?
Yeah, it's fascinating. So where does this leave us? I mean, does this mean that the dream of an AI doctor is fading away?
Oh, not at all. While O1 Preview might not be ready to replace doctors just yet, this research shows just how far AI has come in the medical field. And it's still evolving rapidly.
Right, it's not about replacing doctors. It's about giving them better tools.
Exactly. Imagine a future where AI can assist doctors with diagnosis, help them come up with the best treatment plans, and even keep them up to date on the latest medical knowledge. It would be like having a brilliant, tireless assistant by their side.
That's a future I can get excited about.
Yeah.
It makes me wonder how all of this might change the way doctors are trained. I mean, if they're going to be working alongside AI, shouldn't medical education adapt too?
Absolutely, that's a great point. Imagine using AI models like O1 Preview to create incredibly realistic simulations for medical students. They could practice their diagnostic skills in a safe environment, experiment with different approaches, make mistakes, and learn from them, all without any real-world consequences.
It's like having a virtual patient. They can present with any symptom you can imagine, answer any question you ask, and never get tired.
That's a great way to put it. AI could even personalize medical education, tailoring it to each student's individual strengths and weaknesses. It could make learning so much more efficient and effective.
It's like having a custom-designed medical school right at your fingertips. And it's not just for students, right? AI could also help doctors who are already practicing stay on top of all the latest advances in medicine.
Oh, absolutely. Think about how much information doctors have to keep up with. New research, updated guidelines, new technologies. It's a constant flood. AI could help them filter through all that noise and focus on what's most important for their patients.
So AI could revolutionize both medical training and continuing education. This is really exciting stuff. But what about research? Could AI have a big impact there too?
Without a doubt, AI has the potential to completely transform how medical research is done. Imagine using a model like O1 Preview to analyze these massive data sets of patient information. It could uncover patterns we've never noticed before, identify potential risk factors for diseases, even generate new hypotheses for researchers to test.
It's like having a tireless research assistant who can sift through mountains of data and pinpoint the areas that are most promising.
Exactly. AI could speed up the pace of medical discovery, leading to new treatments, new cures, and a much deeper understanding of human health.
This is all incredibly promising, and it seems like AI has the potential to really revolutionize healthcare in so many positive ways. But I think it's also important to acknowledge that there are potential downsides and ethical considerations that we need to be mindful of as this technology continues to develop.
Absolutely. We need to be careful about how we integrate AI into healthcare, making sure it's used responsibly, ethically, and for the benefit of all patients.
That's a crucial point. It's up to all of us, doctors, researchers, policymakers, and everyday people, to make sure that AI is used in a way that aligns with our values and that ultimately improves the health and well-being of everyone.
Well said. This research on O1 Preview gives us a glimpse into what might be possible. A future where AI and human intelligence work together to solve some of the toughest challenges in medicine. It's a future that's both exciting and a little bit daunting, but I think ultimately it's a future full of hope.
That's a great way to put it. Well, that brings us to the end of our deep dive into the world of AI doctors. We've covered a lot of ground today, from O1 Preview's amazing abilities to the potential impact of AI on everything from medical training and research to the future of healthcare as a whole.
We hope this deep dive has sparked your curiosity and given you some new insights into this rapidly evolving field.
And as always, we encourage you to keep exploring, keep asking questions, and keep diving deep into the topics that matter to you. Until next time. Welcome back to the Deep Dive. We spent this whole episode talking about AI doctors, and specifically this O1 preview model, which is pretty amazing.
It really is. We've seen how it can diagnose complex cases and even explain its reasoning, sometimes even better than human doctors can. Plus, it's getting really good at figuring out treatment plans for patients.
Yeah, but we also talked about how it still has some limitations, especially when it comes to probabilistic reasoning. The situations where doctors have to make tough decisions with incomplete information.
Right, it's like AI still struggles with the art of medicine, those gray areas where human intuition and experience are so important.
Exactly. So it makes you wonder, if AI is getting this good, are doctors going to be replaced by robots?
That's the big question, isn't it? Based on this research, though, I don't think doctors are going to be replaced by AI anytime soon. Medicine is more than just diagnoses and treatments.
It's about connecting with patients, understanding their worries, and providing care with empathy. Those are things that are hard to program into a machine.
Yeah, you're right. And don't forget that AI models, even really advanced ones, are still being developed. They can make mistakes, and they need humans to supervise them and make sure they're used ethically.
So instead of replacing doctors, it seems like AI will become a powerful new tool for them.
Exactly, like an intelligent assistant, helping doctors make better decisions, save time, and ultimately provide better care to their patients.
That sounds much better than robots taking over. But it does make me think about how doctors are trained. If they're going to be working with AI, maybe medical education needs to change too.
That's a really good point. Imagine using AI like O1 Preview to create super realistic simulations for medical students.
Like a virtual patient they can practice on.
Yeah. They could practice their diagnostic skills, experiment with different approaches, make mistakes, and learn from them, all in a safe environment.
So it would be risk-free learning with no real patients involved.
Right. And AI could even personalize the learning, tailoring it to each student's strengths and weaknesses.
That's amazing. It would be like a personalized medical school. And this wouldn't just be for students, would it? AI could also help doctors who are already practicing keep up with all the new medical knowledge.
Absolutely. Think about how much information doctors have to keep up with new research, treatment guidelines, all of it. AI could help them filter through all that and focus on what's most relevant to their patients.
So AI could revolutionize both medical training and continuing education. Pretty exciting. But what about research? Could AI help there too?
Definitely. AI could change how medical research is done. Imagine using it to analyze huge data sets of patient information. It could find patterns we haven't noticed, identify risk factors for diseases, even come up with new hypotheses for researchers to test.
Like an AI research assistant working around the clock.
Exactly. It could speed up medical discoveries, leading to new treatments and cures, and a much deeper understanding of human health.
It sounds like AI has incredible potential to improve healthcare in so many ways. But we also have to remember that there are potential downsides and ethical issues that we need to think about.
You're right. We need to be thoughtful about how we use AI in healthcare, making sure it's used responsibly and fairly, benefiting both patients and doctors.
Absolutely. It's up to all of us, doctors, researchers, policymakers, and everyone else, to make sure AI is used in a way that aligns with our values and improves everyone's health.
This research on O1 Preview gives us a glimpse of what's possible in the future. A future where AI and human intelligence work together to solve the toughest challenges in medicine. It's a future full of possibilities.
That's a great way to put it. Well, that's the end of our deep dive into the world of AI doctors. We've covered a lot, from O1 Preview's amazing abilities to the potential impact of AI on medical training, research, and the future of healthcare.
We hope this deep dive has sparked your curiosity and given you a new perspective on this rapidly evolving field.
And as always, we encourage you to keep exploring, keep asking questions, and keep diving deep into the topics that matter to you. Until next time.